Hello again. Now we will start the EMSA Q&A. I will be moderating this session and joined by, of course, Dr. Duncan, Dr. Nasser, and Tom McGinnis as well. First of all, I just want to thank you all for putting on the summit, for supporting this. And I know it's been very beneficial to help improve STEMI across the state. So thanks for that. And then we'll just dive right into questions. Dave, I'm going to start with a tough one because yesterday at the Stroke Summit, you shared with us your vision and EMSA's vision, of course, for stroke in the future in terms of data flow and management and data sharing. For STEMI, it would be great to understand where we are with that and where you see it going.
Thanks for that, Nicole. Hold on, I want to get a few more shots of espresso in before I answer that question, if I can. I did take this job really with my primary focus centered around trying to improve our access to data. And the statement I made yesterday is really, probably a 10-year goal, but if we can set our goals, I think Clayton made this point well, and incrementally march toward them, they can be achieved. So the ultimate goal that we have at EMSA, and I think our data mission, is to make our way towards all the data accessible in real time, all the time. So easy to say, incredibly difficult to do. We've got 100 steps or more to take, but ultimately we would like to try and transition all the data silos, obviously not into one silo, but we need to bridge those silos and have ready access, real-time access to those data sets and put them in a place, in a space where not just EMSA has access, but LEMSAs and other agencies have ready access to real-time data. And some of the steps we're already taking to make that happen is markedly expanding our health information exchange system. In the next year, we will have doubled our health information exchange to include, I'll say 90% of the geographic area in California. There may be, a large urban center that we still may have to work on, but working towards integrating EMS data, all the pre-hospital data, including the KEMSIS and NEMSIS sort of data sets with hospital data. When we can bridge those gaps readily and in continuous fashion, that gives everybody the feedback they want. It gives hospitals the ready access, immediate access to the EMS data, and it gives EMS ready access to all the points that have been made during this conference. Like, I want to know what that cath report showed. It's returned into the EMS data set. We want to know, first and foremost, we can't even get outcomes a lot of the time. So if we can just begin to learn whether a patient survived or didn't, we can start understanding whether our interventions have made a difference or not. So, health information exchange, number one, bringing important analytic data tools on board, which is already initiated. The first being Biospatial is now contracted with California, and not just with EMSA, but able to bring a sophisticated machine learning, AI analytics to all the LEMSAs as well as EMSA to start looking hard at our EMS data. So we could certainly go on, but ultimately, I sort of envision dashboards with ready access, real-time data for all the agencies involved in EMS, and obviously for hospital systems as well.
That sounds amazing. I think, yeah, having those dashboards and being able to see real-time data is going to be huge. And there are several questions that kind of popped up in the chat to this end is, when and if EMSA, has a target date for having its own,
what's that? Sorry,
STEMI
I think
database.
You're breaking up. You're breaking up a little bit. I couldn't quite catch that. I'm kidding, Nicole. I'm kidding.
I was like, audio issues.
Don't joke on a virtual conference that you're breaking up. When do we expect to have those things? We already have Biospatial in place and integrated in EMSA. we're working on. It's already available. The tool is available to EMSAs. We just have to work on integrations and deploying it out to folks who want to do that. I'll be honest, we've all set EMS aside to a significant degree over the last year and a half, and we're among the most guilty. So we're working hard to bring EMS back onto our desks, data being, one of the first and foremost, moving that out and giving folks access to at least the tools we currently have. So HIE expanding, doubling over the next year. We've got biospatial, which I didn't tell you what that is, but it's a sophisticated vendor, almost really more of an agency that brings EMS and other healthcare data into dashboard configurations with lots of flexibility for the user to align the analytics that you're looking for. So that's going to be readily available. We've got other pieces coming our way. NEMSIS 3.5 is going to have a unique patient identifier aligned therein. That's going to be invaluable to track patients through all the steps that they follow, from EMS to hospitals to transfers to rehab to home. I think that's going to be invaluable not only for stroke STEMI, but for trauma patients. It's going to be very important. So I probably have not answered, the when specifically. I'm hoping in my lifetime and hoping to avoid a STEMI so that that's not too short.
Well, luckily, we have lots of great STEMI centers that can care for you if that were to happen. And we've all learned from our speakers today about better STEMI care. There is another question that's popped up. Is California EMSA encouraging STEMI referral center designation? And if so, how is that being promoted?
That's a great question. Oh, Fareed, can you take that?
Thank you. Go ahead. Go ahead if you want to address that.
Oh, be my guest. I mean, we absolutely encourage that. I don't know that we're publicizing that, but we should be. Fareed or Tom, do you have comments there?
Sure. I think the goal in California is to have the higher standard of care for all the STEMI patients. So higher level of care at the hospital would be better. But as we all know, at the regulations, these authority gave to the EMSA for designation of STEMI centers and promoting them to higher level based on the population, based on the geographic location, and of course at the state level we would love to see more centers with the higher level of care.
And I do want to kick it down to Tom McGinnis, who's actually responding in Southern California, so he's probably on his phone. But Tom, can you offer any additional commentary on that?
No, I don't think so. I think you guys have both covered that pretty well.
Okay, good enough. Thanks.
Great. And Fareed, maybe do you want to mention the survey that you're putting out to get more information about each individual EMSA STEMI plans that might be a resource for people that want to understand what's going on in other systems and cross communicate?
Sure, absolutely. It's actually it's a good opportunity to send out the word that we are working on a survey for all the specialty cares, not only STEMI and stroke, for trauma and for EMS for children. We are gathering some information which we don't have it at the state level, or some of them are outdated, regarding the hospitals, regarding the a point of communication to the hospital, to the EMSAs, regarding these specialty cares. And then after we gather all, with the help of EMSA people, we can make it public and publish it in our website. I think it's a beneficiary for the public in California.
Great, thanks for that. I was a bit surprised to see that only 22 of the EMSAs have STEMI plans currently, just because STEMI plans tend to have been around even a bit longer than stroke. Is there a plan from EMSA to require STEMI plans for all EMSAs at any certain date?
as the language in regulation says may, so this is not the mandatory system to adopt, but we encourage all the LEMSA to adopt this system, especially that's going to create, some sort of collaboration between the LEMSAs for the neighboring, covering the STEMI patient. And, but if they adopt this system, they have to, submit their plan to us for approval with all the information required by the regs. And we are hoping we get sooner, better. But I'm sure, COVID was one of the reasons. Some of these LEMS contacted me actually that they are working on their plans. And a lot of them, they submitted, a lot of them actually submitted their annual update, which we're expecting everybody to submit with their EMS plan annually, not as a separate, a complete plan, because that's going to create a lot of work for them and for us to review. But as long as they submit their update to us, that should be great.
All right, thank you for that thorough explanation for everyone. I hope that, Tom, I can direct a couple of specific data questions to you for people who are developing their data collection. Where should they turn in terms of understanding exactly what the submission requirements are? Is it directly in the regulations, or are there other resources they should use?
So the regulations tell everybody what to submit data. At this point, data submitted to ISEMA through our program that is being by image trend. I
think you're breaking up a little bit, Tom. Can you try that again?
Data trend, and so probably a little later this, we're going to formally launch that so we can get everybody submitting the data in the uniform way and get it all put into the system so we can start running some reports and generating information out of it.
Thanks, Tom. You came in clear at the end, but the part that you were describing about the ISEMA data flow, that got cut out for me at least. Would you mind just clarifying that?
Yeah, I don't, it's not, for ISEMA.
I think we're worse. I'm sorry. Fareed or Dave, if you're able to jump in, great. Otherwise, we'll see if.
I mean, just a quick comment. We do specifically have all the data points required specifically listed within the regulations. So that's always a good start. And if there are any questions regarding data submission, those can be put in email form to Fareed or Tom, preferably both, and we will march through those, make sure people have their answers.
Yeah, I can add to this. Basically, those variables that added to the regulations, they are the minimum requirement for the data submission by the state. And I think most of the LEMSAs, they have desire to collect more variables regarding STEMI for their QI purposes, which we are hoping in the future we can add those to our system and gather those from the LEMSA for the creating report and for the QI purposes at the state level.
Okay, that's great. So it sounds like right now we have a minimum set, but there may be opportunities in the future to collect individual elements that are of importance to particular LEMSAs and then get that reported out as well. Okay. It looks like there's a question that just popped up. Will EMSA publish the approved STEMI plans on their website?
I think those are the public, record. We can publish them in the in our website after approval, not before.
Is that being done currently, Fareed? Forgive my ignorance, I'm not aware.
No, I don't think that we started publishing all the plans, but that's going to be part of my future to do. For sure, we're going to do that.
I'm sure that list is short, so no worries there. All right, I'm not seeing other questions. Is there anything for you, Dave, Tom, that you would like to relay while we give a second to see if anybody else has last minute burning questions for you?
I would just say, you know, it's interesting to do a virtual conference. I'll just say amazed how well these things can go. And Nicole, thanks so much for your and everybody else's input and hard work on making this, you know, appear seamless. There's so much behind the scenes happening, and just so greatly appreciated. I learned a lot today. I will not bash a virtual conference again. I had a good time, although I can't really wait for you know, in person. Hopefully in the next, we'll say, few months, few years, you know, whatever it takes. Thanks everybody for joining. We really enjoyed putting this together, and you know, we'll see you next year, either in person or on a screen, I suppose. Fareed, anything else?
Actually, I just wanted to, before everybody goes, I just wanted to thank you, everybody, to participating, and also a special thank to all our presenters with the great materials, fantastic live Q&A sessions. I also cannot thank enough for our summit committee members with the leadership of Nicole. Thank you, Nicole. That was a great, you know, experience. I learned a lot for, you know, putting together and conducting a summit. I also like to appreciate American Heart Association and Kaiser Permanente for their collaboration and support, especially providing CEs and CMEs by American Heart. And I would like to point out that within a week, please look for an email in your mailbox regarding how to claim your CE and CME with completing your evaluation. These summit and also stroke, we both are recorded. We're gonna put it in our website, posted in our website for the educational purposes. I also apologize for any technical issue you might have experienced. This is, you know, virtual. That's my first experience for the putting together a virtual summit, but I really enjoyed it. I really learned a lot from this summit, and I hope everybody else enjoyed it as well, and see you all next year. Have a great rest of the day.
Thanks, everyone.